Hi friends, good evening to all. Welcome to our channel, The Nurse. Here we are discussing about third part of cardiovascular system questions and answers with their explanations. So don't forget to subscribe our channel, The Nurse. So we'll go to our topic, cardiovascular nursing questions and answers with the explanation. So cardiovascular system questions and answers part 3. Before going to our topic, today is Christmas Eve, so happy Christmas to all. Merry Christmas and Happy New Year in advance. So we'll go to our topic, cardiovascular system questions and answers. Here I will go a little faster. Today is Christmas Eve, so I am going a little faster so you can enjoy after this video. First question: type of angina which is of chronic type and is unresponsive to interventions. Type of angina which is of chronic type and is unresponsive to interventions. Prinzmetal angina, unstable angina, intractable angina, variant angina. Type of angina which is chronic type and is unresponsive to interventions.
CSI नेट क्रैक करने का फॉर्मूला है कॉन्सेप्ट को
Correct answer is intractable angina. The type of angina which is unresponsive to interventions is known as intractable angina. Prinzmetal angina is also called variant angina. Prinzmetal angina is also called variant angina, results from coronary artery spasm which is responding to treatment. So here the Prinzmetal angina which responding to treatment. Unstable angina, it is also called pre-infarction angina. Unstable angina is also called pre-infarction angina, occurs with an unpredictable degree of exertion or emotion. Unstable angina, also called pre-infarction angina, occurs with unpredictable degree of exertion or emotion, which is also responding to treatment. Next question. What position should the nurse place the head of the bed in to obtain the most accurate reading of jugular vein distension? What position should the nurse place the head of the bed in to obtain the most accurate reading of jugular vein distension? High follows, raised 10 degrees, raised 30 degrees, supine position. To get jugular vein distension, accurate reading of jugular vein distension. Hi, good evening. Good evening, Mukesh, Vishaga, Raju Naik. Hi, Nisha VS, Kunka Kasi. Oh, so screen. Okay, sorry. So now it is okay, screen. Okay, correct answer is raised 30 degrees. The position which need to get accurate reading of jugular vein distension, that is raised 30 degrees. Jugular venous pressure is measured with a centimeter ruler to obtain the vertical distance between the sternal angle and the point of highest pulsation with the head of the bed inclined between 15 to 30 degrees. Jugular venous pressure is measured with a centimeter ruler to obtain the vertical distance between the sternal angle and the point of highest pulsation with the head of the bed inclined between 15 and 30 degrees. Next question. At which age should first screening of high blood pressure to be done? Based on American preventive measures, At what age should first screening for high blood pressure to be done? 26 years, 18 years, 30 years, 20 years. Hi everyone. Question number 3 answers. Okay, the correct answer is 18 years. The US Preventive Service Task Force recommends that a healthy adult get a first blood pressure check at the age of 18 years. The US Preventive Services The US Preventive Services Task Force recommends that a healthy adult get a first blood pressure check at the age of 18. Next question. In which age group of men does the risk for high blood pressure go up? In which age group of men does the risk for high blood pressure go up? 39 to 49, 50 to 59, 60 to 69, 70 to 79. Increase in the BP. High risk for increase in the BP in which age group? Question number 4. Okay, correct answer is 50 to 59. The risk for high blood pressure, that is more in men, that is in age between 50 to 59. Next question. What is the most commonly involved coronary artery in myocardial infarctions? This question is changing, and same question only, little with a little modification, it is coming different ways. What is the most commonly involved coronary artery in myocardial infarction? Posterior descending artery, left anterior descending artery, left circumflex artery, right coronary artery. Question number 5. In previous questions and all, in 2 videos, we discussed the related questions. Correct answer is left anterior descending artery. The most commonly involved artery in the myocardial infarction, that is left anterior descending artery, which supply anterior part of the heart and the septal. Order of the coronary artery involvement. First and common involvement, that is left anterior descending artery, then followed by right coronary artery, then circumflex artery. First one is left anterior descending artery, right coronary artery, then circumflex artery. Left anterior descending artery and circumflex artery are the branches of left coronary artery. And here one more question is there. What is the other name of left anterior descending artery? What is the other name of left anterior descending artery? Because of the common involvement in the myocardial infarction, one notorious name is there for left anterior descending artery. Any idea? Anyone knows? Other name of left ascending artery, because it is commonly associated with the myocardial infarction. Yes, Deepshika, Shaiju, Lubna, Jinsi, those 3 people given correct answer. Widow making artery or widow maker. Left anterior descending artery, also known as widow maker, because it is commonly associated with the myocardial infarction. Keep it up. Nimya Sanish also given correct answer. Sixth question. What does the ECG shows in Prinzmetal angina? What does the ECG shows in Prinzmetal angina? ST segment elevation, ST segment depression, prolonged PR intervals, absent P waves. Sixth question. What does the ECG shows in Prinzmetal angina? Give your answer first. We will finish this video. What does ECG shows in Prinzmetal angina? Okay, correct answer is ST segment elevations. In Prinzmetal angina also, main ECG changes, that is ST segment elevation only. ST elevation is due to transmural ischemia which occurs in Prinzmetal angina. Same as usual MI, in Prinzmetal angina also it is due to the ischemia. ST elevation is due to transmural ischemia. Prinzmetal angina is episodic chest pain that occurs at rest. Prinzmetal angina is a characteristic feature of a Prinzmetal angina, that is episodic chest pain that occurs at rest. That is important. The chest pain or angina occurs at rest. Next question. Beck's triad is associated with. You already made a separate video regarding Beck's triad. So question. Beck's triad is associated with cardiomyopathy, hypertension, cardiac tamponade, tetralogy of Fallot. Beck's triad is associated with. It is in detail, it is explained in our separate video. You can check it there. Okay, please try to give your answers. Question number C. Okay, correct answer is cardiac tamponade. All of you know, very familiar to this question. Beck's triad is associated with cardiac tamponade. The classic signs of cardiac tamponade are known as Beck's triad. The classic signs of cardiac tamponade are known as Beck's triad, in which includes hypertension, muffled heart sound, and increased jugular venous distension. The classic triads of cardiac tamponade includes hypertension, muffled heart sounds, and increased jugular venous distension. Cardiac tamponade is a pathological compression of the heart caused by excess fluid in the pericardial sac. The excess fluid may be blood or any other fluid, or pericardial fluid itself may cause compression to the heart. That condition is known as cardiac tamponade. Excess fluid in the pericardial space that will compress the heart. That condition is known as cardiac tamponade. It is a fatal condition unless it is treated surgically. Cardiac tamponade is a fatal condition. Emergency surgery is required to remove the extra fluids. Next question. Dark discoloration in the myocardium in the first 24 hours after MI is due to. I think it is a new question for you. Dark discoloration in the myocardium in the first 24 hours after MI is due to neutrophils and macrophages, coagulative necrosis, granulation tissue, fibrosis. This question is related to pathological changes due to myocardial infarction. Eighth question answers. Dark discoloration. We'll check the correct answer. Correct answer is coagulative necrosis. Dark discoloration in the myocardium in the first 24 hours after MI. That is due to coagulative necrosis. The yellow pallor is indicative of inflammation characterized by neutrophils and macrophages within the myocardium. The yellow pallor is indicative of inflammation characterized by neutrophils and macrophages within the myocardium. In the first 24 hours of after NMI, there is dark discoloration due to coagulative necrosis. During the first week, there is an inflammation signified by the yellow pallor. During the first week, there is an inflammation signified by the yellow pallor, after which 1 to 3 weeks, granulation tissue emerges marked by a red border entering from edge of the infarct. Months after, white scar forms. This is due to fibrosis. So these are the pathology of a myocardial infarction, the healing after the myocardial infarction, healing with the fibrous tissue. Next question. Condition which causes hypertension in upper extremities and weak pulses in the lower extremities. Condition which causes hypertension in upper extremities and weak pulses in the lower extremities. Tetralogy of Wallet, VSD, preductal coarctation of aorta, ASD, atrial septal defect. ASD means atrial septal defect, VSD means ventricular septal defect. Ninth question answers. Okay, correct answer is preductal coarctation of aorta. The preductal coarctation of aorta causes hypertension in upper extremities, that is in hands, and same time weak pulses in lower extremities. So preductal coarctation of aorta will causes hypertension in upper extremities and weak pulses in lower extremities. Preductal coarctation results when an intracardiac anomaly during fetal life decreases blood flow through the left side of the heart, leading to hypoplastic development of the aorta. Preductal coarctation results when an intracardiac anomaly during fetal life decreases blood flow through the left side of the heart, leading to hypoplastic development of the aorta. Next question. ECG records electrical changes in which of the following layer of the heart? Easy question. ECG records electrical changes in the which of the following layers of the heart? Epicardium, pericardium, endocardium, myocardium. Easy question. So all of you know the correct answer. We'll check it. That is myocardium. ECG records electrical changes in myocardium. ECG is an electrocardiogram which records electrical changes in the myocardium layer of the heart, that is middle layer of the heart. Body fluids contains iron that produce electric current and causes changes in the myocardium. This is actually interesting question. Chronotropism refers to rhythmicity, conductivity, excitability, contractility. Chronotropism refers to rhythmicity, conductivity, excitability, contractility. Correct answer is rhythmicity. That is, chronotropism means rhythmicity. We'll check what is it. Chronotropic drugs may change the heart rate and rhythm by affecting the electrical conduction system of the heart and the nerves that influence it, such as by changing the rhythm produced by the sinoatrial nodes. Chronotropic drugs may change the heart rate and the rhythm by affecting the electrical conduction system of the heart and nerves that influence it, such as by changing the rhythm produced by the SA node. Positive chronotropes increases heart rate, negative chronotropes reduces heart rate. So can you give any example for positive chronotropes and negative chronotropes? Examples of positive chronotropes and negative chronotropes. Can you give? Nisha VS beta blockers example for negative or positive? Yes, negative chronotrop is digoxin. That is correct. So what is positive? Yes, atropine is positive chronotrop. Any other medicines? Yes, dopamine is positive chronotrop. Manjum is amlodipine causes negative or positive chronotrop. Atropine is positive chronotrop. Amlodipine is an example of negative chronotrop. Okay. Anyway, you know familiar with this negative and positive chronotrop. Keep it up. Good work. Next question. Water hammer pulse occurs in. Water hammer pulse occurs in arteriosclerosis, hyperthyroidism, aortic regurgitation, all of the above. So here common cause of water hammer pulse is asking arteriosclerosis, hyperthyroidism, aortic regurgitation, all of the above. I think you are familiar with this question. This is a repeated question only. Most of the government IIMS exams, this question is very common. Water hammer pulse is related with aortic regurgitations. So most of you given correct answers. Good work. So we'll check an explanation. Water hammer pulse is a physical exam finding with many different etiologies. However, it commonly associated with aortic regurgitations. So there are other causes also, but commonly associated with aortic regurgitations. It will feel like a tapping impulse through the patient's forearm due to the rapid emptying of blood from the arm during diastole. It will feel like a tapping impulse through the patient's forearm due to the rapid emptying of the blood from the arm during diastole. That is water hammer pulse. Next question, easy question. Try to answer it. A blockage within the heart arteries caused by the death of heart muscle cells is known as a blockage within the heart arteries caused by the death of heart muscle cells is known as an embolism, an infect, an abscess, a trochanter. So all of you know this answer. Okay, that is your correct answer only. That is option B. And in fact, a blockage within the heart artery is caused by the death of heart muscle cells is known as an infarct. So that is about today's video. So there is an important information for you. Tomorrow there is a live class, that is Christmas Day. So the class will be at 4 o'clock evening. The topic is very interesting topic, that is COVID-19 vaccine. Tomorrow's class related to COVID-19 vaccines, questions and answers. The class scheduled at 4 o'clock tomorrow. So don't miss it. It is very important questions for upcoming exams. All the exams, corona related questions will come. You can expect. So tomorrow's class is COVID-19 vaccination, questions and answers. Merry Christmas, Manju Misra. Now you can celebrate. Happy Christmas. So please be ready at 4 o'clock tomorrow evening. COVID-19 vaccination, questions and answers. Very interesting topic. You will get some knowledge regarding COVID-19 vaccination. Pallavi, Merry Christmas. Ashok, Minimod, Happy Christmas. Okay, we will wind up here. Happy Christmas, Happy Christmas. We'll finish this video here tomorrow, 4 o'clock. Don't miss it.